If you've been wondering why your desire has changed, why sex feels different, harder, or maybe not appealing at all, I want you to hear this first. Nothing is wrong with you. And if you're a partner watching this isn't about blame. It's about understanding what's actually happening in the body so you can move forward together with compassion instead of confusion. Hi, I'm Vanessa Tarfon, sex therapist and founder of Authentic Awareness. I speak to so many women who quietly ask questions. They've been Googling late at night, why don't I want sex anymore? Is this menopause? Is it normal? And partners often have their own silent questions as well. Did I do something wrong? Is she no longer attracted to me? Is this just how it is now for the rest of our lives? And this is what it's going to look like going forward. And all of these questions are asked quietly because they aren't shared between the couple. Neither wants to voice in front of the other the unknown of their concerns because they don't want to upset their partner with the wrong answer or cause stress and anxiety. But here's the truth. Sexual desire often changes long before periods stop. Perimenopause can begin anywhere from 5 to 10 years earlier than most people expect because they think of menopause only as once that menstrual cycle stopped, which is incorrect. And it affects sexuality much earlier than that. So, for clarification purposes, menopause is a retrospective diagnosis only given once your period has ceased for 12 months. And in Australia, the average menopause age is around 47 and a half. So, if you or your partner is experiencing symptoms and therefore in perimenopause, they can really start seeing changes happen from 37 years old. But what changes happen in the body to cause sexuality and sexual desire changes? Let's talk physiology and hormones. Estrogen supports vaginal tissue health, lubrication, elasticity, and sensation. Women lose fatty tissue around their vulva and clitoral hood. So you can experience increases in itching or chafing to that area. The vaginal canal actually becomes thinner and drier, and it can also become smoother and shorter. So your cervix and uterus actually drop. The vagina also changes from a more acidic environment to a more alkaline environment, which can make you more susceptible to UTIs, which may create more persistent or smelly discharge. You may also experience vaginal bleeding changes, so duration, frequency, or heaviness, or some inflammation. Now, all of this can make sex uncomfortable or even painful. And of course, then your desire drops because you don't enjoy the sensations. Testosterone also plays a role, but in libido, erotic motivation, confidence, and sexual curiosity for women and men. Okay, it is not the male hormone, as many say. It has a very clear sexual function for everyone. Progesterone, which supports calm, sleep, and emotional regulation. When that shifts, anxiety and irritability often increase. Then you've got vasomotor symptoms like hot flushes, night sweats, mood swings, and insomnia that people don't associate directly with sex, but they do impact desire and activity. Okay, if you are tired because you aren't sleeping well, obviously your interest in then physically being active and intimate is going to be hard. If you're a partner, understanding this actually helps you realize this isn't rejection. And I promise your partner is probably upset about the situation herself, but it is biology. And all we can do is work with it and around it. However, physiology isn't everything when it comes to sexual desire. One of the most overlooked parts of desire in midlife is the nervous system. During the menopause transition, stress tolerance drops, overwhelm increases, and the body becomes much more vigilant. When the nervous system is in survival mode, pleasure is deprioritized. This is why saying, just relax or we never do it anymore actually shuts desire down further, even though it's usually said from a place of longing. Know what you want the end goal to be, but these natural defensive reflex responses actually drive you further away from that end goal than you want to be. What is crucial for both partners to understand is the desire doesn't disappear, it shifts from quick arousal to slow warming, from performance-based sex to presence-based intimacy. Many couples think that something is broken when in reality, the old model just no longer works. And that is actually really exciting. And when you can start having the best sex of your life. What actually stops people a lot more at the beginning when those changes really start to impact their sex life and intimacy is the grief. Grief for the body that you used to have, fear that intimacy is over, shame around not wanting sex, and partners may feel rejected, confused, or scared to initiate. All of this is completely normal, and none of it means that intimacy is over. Now that you understand why desire changes during the menopause transition, the next question is always, what can we actually do about this without forcing, pressuring, or faking desire? And that's exactly what we're going to cover in the next episode. If this is resonating with you and you want support that considers your body, hormones, relationship, and stage of life, I work with individuals and couples, and you can book a private one-on-one session with me by contacting me via email or by my website.